Good afternoon, everybody. Welcome to day 34, I think it is, to the 90-day live chat. Today I would like to introduce you to the topic of trauma. And trauma is really a big topic, and I won't cover it all. Entirely impossible. But I would like to give you a couple of ideas what trauma is and talk a little bit about typical symptoms. My name is Frank Brewer. I'm the principal at New Path Psychology and a clinical psychologist. So it is Borderline Personality Awareness Week, and we cannot talk about borderline personality disorder without talking about trauma, because trauma is really at the basis of BDP. And sometimes BDP is also called complex PTSD because the nature of the trauma people with BDP have experienced is complex, and it's very diverse. Yeah. So the term trauma refers to the fact it's like a psychological injury. Yeah. So where a person has experienced a threat to life or threat to physical integrity, or has witnessed violence or experienced violence of really some sort, and leaves the person in shock. Yeah. So basically there's two criteria. It's the threat to life or to physical injury or integrity, and the reaction of extreme fear and shock, which sort of is the basis then for developing post-traumatic stress disorder, which doesn't have to be that way. So not all people who are exposed to traumatic events do develop PTSD. So there's a couple of factors that sort of make it more likely that someone develops a PTSD, for example, social support. So what I'm trying to say is each traumatic event definitely triggers the fight or flight reaction, yeah, and more often than not, it's the flight reaction and not the fight reaction. So we want to run away, yeah. So the body is sort of filled with hormones, with cortisol and adrenaline and so forth, and there's a lot of energy involved and set free to actually to run away. Yeah. So, and that is okay, but the problem when it comes to developing PTSD is that we sort of remember, we remember the traumatic events, we rehash, we recoup and so forth, we think about them, and that again sets free the same response, the same anxiety or fear response, the flight response, and so the body is constantly overflowed by adrenaline and this strong reaction, I should say. So basically, when it comes to developing PTSD, we have three symptom groups. Yeah. So one symptom group is re-experiencing the trauma. So that could be that a person has nightmares. Yeah, very vivid nightmares. Sort of. Yeah, that's totally re-experiencing, or flashbacks, that sort of some situational triggers immediately brings up the memory of the traumatic event. Hi Tess, thanks for joining. Well, hope you have a good day so far. I'm just talking about a trauma, typical symptomatology of trauma response, and I'm thinking about nightmares and flashbacks. Yeah, so which brings back the memory and the emotional response. So re-experiencing is one of the big three symptom groups. Another symptom group is fear. Yeah. So, and the anticipation of catastrophes. Yeah. So, sort of the threshold to feel threatened is absolutely lowered, and we see sort of the world as a dangerous place, and we expect the next catastrophe to be just around the corner. Poolside in Brisbane, lucky you, Tess. Well, I'm jealous. Well, all right. I had a good time in Byron Bay, as you know, so no problem. So the fear things, for instance, if you had a traumatic experience in the past, you may think, well, when my partner goes to work, they may never come back. Yeah. So which is related or triggered by the past experience, and and that leads to another symptom group, which is called avoidance. Yeah, we don't want to be remembered all the time. We don't want to be reminded all the time, and think about the traumatic event, because it's painful, it's stressful. And avoidance can be really bite you in the bum. I had one client, he reported he was suffering from, he had two motorbike accidents, which haven't been very serious when you look at it from an objective point of view. But his avoidance was so strong that he said, well, I'm okay. Yeah, he said here for many times in this room and said, I am okay. I'm neither depressed nor do I have PTSD. And it took actually quite a while to make him aware that his symptoms, like numbed feelings, is actually a symptom of PTSD. Yeah, not feeling anything, being dissociated from what we actually feel, and it's not a nice place to be in. What else to cover? Look, I mean, all these experiences like horrific accidents or the shooting in Las Vegas or war experience, this is usually associated with PTSD or traumatic events, and this is called single traumatic events. But likewise, or even more important, is sort of ongoing trauma, yeah, like neglect from a caregiver or attachment traumas that parents are not available or one parent is not available. This has a massive impact to people's life, because they cannot repair. Yeah, a child cannot repair, and certainly cannot repair anything that is sort of, it's usually beyond their scope of coping skills anyway. But the earlier the trauma happens, and depending on the developmental stage of the child, they're completely overwhelmed. Yeah, I hope that makes immediate sense. And there's other forms of trauma like bullying or sexual assault, all these kind of things done by often it's a caregiver, it's a close family member, or an older brother. This all adds up to what we then call complex PTSD. Yeah. So PTSD is considered an anxiety disorder, and because of that, it floods the body with all sorts of stress hormones and feelings and emotions of fear, and that the world is an unsafe place. So it is fair to say that PTSD is a disorder of sort of we're suffering from the memory, because the memory then triggers the emotional reaction. And in therapy we trying to actually cut the link between the memory and the emotional response. Yeah. So that means we cannot extinct the memory, and it's not required, but we can sort of work towards reducing the emotional response. And there's a lot of different ways of going about it, which I can't cover here. All sorts of things, from hypnotherapy to rewind techniques, exposure, talk therapies, and so forth. Well, it's certainly important to learn to manage everyday stress, and to learn to sort of become more resilient to triggers, yeah? Triggers for the dissociative states, and so forth. It's probably an endless topic, and thick books have been written about it. It's fascinating, but it's so important because it's not only relevant for borderline personality disorder, but also all sorts of other so-called Axis 1 disorders like depression, anxiety, and so forth. You name it, you find traumatic events, and then in therapy we need to find out how relevant it is still for today's life. Yeah. Anyway, yeah. Is there anything else I should cover? Not sure. Tomorrow I'm going to see a presentation on borderline personality disorder, and I hope that there will be some information about further treatment options. Yeah, as said yesterday, it's often good to have a combination of group and individual therapy, and so forth. So I'm keen to get those information, and I will be vlogging probably around lunchtime tomorrow, and to report about what I've heard, what I will be hearing tomorrow morning. Okay, I wish you a wonderful, it's hump day, isn't it? Well, Wednesday is hump day. All right, I hope you have a good day, and I catch you tomorrow for day 35 of the 90-day live chats. Thanks for joining. Bye for now. Have fun in Brisbane, Tess. Catch you later. Bye.